And it's also good that, if possible, put them in schools where they have special needs children. Because the beauty of that is that the teachers special needs schools are trained to handle those kind of children and teach them with the style that they can learn with. So there are also areas where they put them in inclusive school, whereby they put them in a school that has special needs children and those who are without special needs condition. But there is always a need for assessment to actually be able to know which best school they can attend. This will go a long way in helping. It is important that parents have cameras in their homes when those children are with nannies or house help. Let there be cameras in your home that you can use to monitor the way the nannies are treating those children, because sometimes even parents without children with special needs to have cameras in their home when they have nannies or house help, so that these children will not be subjected to abuses and emotional trauma. A lot has happened in the past whereby housemaid and house help, there are good and fantastic housemaid and house help, but there are some that are very toxic, beating, flogging, traumatizing children. And those children, because they cannot talk, their parents, when they come, they behave well while the parents is around, but when the parents are not there, they are lioning. Have cameras at home whereby you can monitor the food the child is eating, the water the child is drinking, and the interaction between the person, the caregiver, and the child. In addition, if you notice that the burden of care for the child or the children is affecting you, try to see a therapist. Ensure you see a therapist so that you don't get depressed, you don't get into anxiety or have post-traumatic stress condition. See a therapist to learn coping skills, because in most cases, sometimes it is not the activity, it is not the condition of the child that is depressive, but it is the ignorance and the perception that the situation has no solution that is worrisome. So see a therapist to help you, teach you strategies to help you cope. It is important that parents with children with special needs, once the child is enrolled into a treatment center, follow the appointment regimen given by the professional. Bringing the child regularly for appointment without defaulting goes a long way in ensuring that the treatment will work. And where medication is recommended, such medication should be used based on strictly following the recommendation of the doctor. And where psychologist is needed, tests must be carried out and the therapy must be followed. Because in treating children with special needs, it is a multidisciplinary approach. Different professionals come together to manage the child for effective results to happen. So these are cardinal points that parents with special needs must know. It is important as well as very crucial that children are helped whenever they are not doing the right thing. The fact that they have special needs or special condition does not mean that they should not be corrected when necessary. But correction should be done with love, with understanding. Correction should be done with that holistic understanding of their strengths and weaknesses. And this will go a long way in helping those children to try and do better.